Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and all my videos are directly referenced from the internationally accepted US National Medical Library. Therefore, you can trust the information I give you today and in all my videos. Today we are going to talk about diarrhea or dysentery or loose stools, or sometimes they are also called the runs, the trots. Basically, we're going to talk about what causes it, what basic information every single one of you should know, and what you need to share to everyone, right? And did you know most adults suffer from diarrhea at least once per year, and every child suffers like twice a year from diarrhea? So you need to know about diarrhea. That's why this topic is so important.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So what is diarrhea? First question is that. Diarrhea is basically loose stools, watery stools, and increased bowel movements. So diarrhea is defined if you have loose stools for 3 or more times in one day. That is the definition of diarrhea. And diarrhea can be acute or chronic. Acute diarrhea is the diarrhea which lasts for a very short time, and it is very common. The most common type of diarrhea is acute diarrhea. What you get every year is acute diarrhea, and acute diarrhea usually lasts for about 1 or 2 days. It might last longer, but it's short-lived, and it's a very common problem, like I said. And the most characteristic feature of acute diarrhea is that after a few days, it goes off. It goes away on its own. On its own. You don't need any medication for acute diarrhea. Yes. But if diarrhea is lasting for more than a few days, it might be a sign of a more serious condition, more serious problem. That is chronic diarrhea. And chronic diarrhea has to be more than at least 4 weeks. So if your diarrhea lasts more than 4 weeks, then you might have chronic disease, chronic diarrhea. Chronic diarrhea may be continuous diarrhea for 4 weeks, or it might be off and on. It might come and go. So who gets diarrhea? People of all ages can get diarrhea. On an average, an adult gets diarrhea once a year, children gets diarrhea twice a year, and people who visit developing countries are at a higher risk of traveler's diarrhea. If you change your state, if you go to a new place, then you might be consuming contaminated food or water, leading to diarrhea. So coming on to causes. What causes diarrhea? The most important cause are contaminated food and water. What are they contaminated with? Bacteria, virus, parasites. Bacteria can be of various types. Viruses can be flu virus or rotavirus. Rotavirus is the most common type of diarrhea in children. And then coming on to parasite. Parasites, as we all know, are tiny little organisms found in the contaminated foods which actually live inside you. Worms. Anyways, so these all things can cause diarrhea. These all bacteria, microorganisms. Apart from microbes, medicines, side effects. Medicine side effects can lead to diarrhea. Certain antibiotics, certain cancer medicines, and certain antacids, especially which contain magnesium, can cause diarrhea. Then sometimes food sensitivity, food allergies, food intolerances can lead to diarrhea. For example, if you are intolerant to lactose, you might have diarrhea when you are taking any kind of milk or milk substance, milk product. So diseases, apart from this, diseases which affect your stomach or your intestines, small or large, can lead to diarrhea. For example, Crohn's disease, ulcerative colitis. Sometimes if there is problem with the colon function, irritable bowel syndrome, that can also lead to diarrhea. These topics will be covered very soon in my channel. Then a very important reason of diarrhea are surgeries, stomach surgeries. People who get stomach surgeries often get diarrheas after the surgery, and that is because after the surgery food actually moves faster through the digestive system. It moves quickly because of the surgery. Even after gallbladder surgery, even after you take out the gallbladder, because of the bile, undiluted bile is constantly pouring in your intestines, which gives a laxative effect, you will have diarrhea for many weeks, sometimes a few months. So surgeries can lead to diarrhea, and many times no cause can be found even after investigating. But good thing is, if your diarrhea goes away in a few days, you do not need to know what is causing it. You don't need to find out. It's gone. So why do you have to go to a doctor? When should you? If you have persistent diarrhea for more than a few days, if you're an adult and diarrhea is more than 2 days, if you're a child and diarrhea is more than 24 hours, talk to a doctor. If you have any sign of dehydration, we'll come to that. If you have pain in the abdomen to stomach, if you have loss of bowel control, if you're passing stools involuntarily, if you have an urgent need to pass the stools or go to the washroom every time, if you have fever, if you have stools containing blood or pus, if you have stools which are black and tarry, if you have any sign of dehydration, again, that's the time when you should go to a doctor. If a child has diarrhea, parents and caregivers should not hesitate to call or go to a doctor, because diarrhea can be especially dangerous in newborns and infants. The most important complication of diarrhea is dehydration. Dehydration means that your body does not have enough fluid to work properly, and dehydration can be serious, especially in 3 types of people: children, old people, elderlies, and people with weak immune system. So you have to take care of dehydration, most importantly. There can be other symptoms associated with diarrheas like pain, cramps, loss of bowel control, urgent need to go to the washroom, and you might have fever, chills, and black stool, sometimes bloody stools, just like I have described. That fever chills actually suggest that you have a bacterial viral infection. So that's all about symptoms and when you should go to a doctor. And when you do go to a doctor, the doctor does a physical exam, asks you about your history, about your medicines, about your allergies, about everything there is to know about your medical side. And then we do some tests. Sometimes we do blood tests to look for bacteria, virus, parasites, and signs of diseases or infections. And we might do stool tests. We might ask you to stop eating certain types of foods if you suspect, or if we suspect that those foods are causing diarrhea. Some medicines can be replaced if they are causing diarrhea. And if you have chronic diarrhea, we might have to do further more tests to find out, pinpoint what is the cause, what is the chronic condition, what is the chronic disease. Only by finding these problems, the actual cause, the proper treatment can be done. Without finding these causes, there is only one treatment. One single treatment of diarrhea which you can do at your home is a replacement of lost fluids and electrolytes. Basic prevention of dehydration. Yes, that's actually the only treatment needed by many types of diarrhea. Only treatment, because they are going to go away on their own. You don't need to treat them by medicines. You need to treat them by fluids, rest, electrolytes. And depending upon the cause, if you don't get relief by these things, by rest in a few days, then you need to go to a doctor and they will decide what kind of medicines do you need depending upon what is causing your diarrhea. If you're an adult, drink a lot of water. Drink a lot of fruit juices, sports drink. You can drink sports drink, you can have sodas, but without caffeine. No caffeine. Caffeine will make things more problematic. Then if your symptoms slowly improve, then you can start on soft diet, bland food, avoid spicy, hard and oily, fatty foods. If you have children who have diarrhea, they should be given oral rehydration solution, ORS, to replace the fluids and electrolytes. Electrolytes, fluids should be given to adults as well. Electrols or ORS can be used in them as well. And only two types of diarrhea can be prevented: rotavirus diarrhea and traveler's diarrhea. For rotavirus diarrhea, there is a vaccine which is there, which is given to babies in 2 to 3 doses. For 2-dose vaccine, Rotarix vaccine is available. For 3-dose, Rotatec is available, which can be given to babies. In adults, traveler's diarrhea can be prevented. Whenever you're going to a new place, make sure that you drink bottled water, purified water for drinking, for making ice cubes, and even for brushing your teeth. And if you have to use tap water, then boil it or use iodine tablets daily. Make sure that the food which you eat is cooked properly and fully, and it is served hot. Avoid unwashed or unpeeled raw vegetables or fruits. That's all you need to do to avoid traveler's diarrhea. So these are the basic things which every single one of you should know about diarrhea. So don't hesitate to share these videos to all your friends and social network platforms, and make sure to write your comments down below. Make sure to write to me how you're liking my videos, what are the topics you want me to cover, and make sure to give your love, show your love, and make sure to show your appreciations, and make sure to subscribe and hit the bell icon of both my channels, Dr. Education and the FAQ channel, Dr. Education FAQs. Till next time, I'm Dr. Paramjeet. Those who don't know me, I'm a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and this is my channel. Soon I'm going to address diarrheas in infants, in children's, etc., with a specific videos. And till next time, stay connected, stay healthy.